Good day everyone, my name is Mitra Siratan and this is my video presentation on the application of nursing theories to mental health care, and my selected theorist would be Hildegard Peplau, and we'll be going further into depth on the interpersonal relations theory. Hildegard Peplau's interpersonal relations theory focuses on the therapeutic relationship between the nurse and the patient as a foundation of effective nursing care. Peplau describes nursing as an interpersonal and therapeutic process that promotes healing through meaningful human connections. Her theory is especially significant in psychiatric and mental health nursing, where emotional support, trust, and communication are essential components to patient recovery. Peplau explained that the nurse-patient relationship develops through four distinct phases. We have the orientation phase, the identification phase, the exploitation phase, and the resolution phase. During the orientation phase, the patient seeks help and may feel anxious, confused, or even vulnerable. The nurse introduces themselves, clarifies their role, establishes trust, and begins to identify the patient's problems and their needs. This phase sets the foundation for a safe and therapeutic relationship between the patient and the nurse. In the identification phase, the patient begins to respond to the nurse and engage more openly in care. Trust deepens and the patient feels more comfortable expressing emotion, concerns, and personal experiences. The nurse provides emotional support and strengthens therapeutic communication. The exploitation phase occurs when the patient actively participates in their care and makes full use of the available support and services around them. The patient becomes more involved in their treatment, asks questions, and attends therapy sessions and group sessions, and they begin working towards a recovery goal. The final phase is the resolution phase, and that occurs when the patient's needs have been addressed and greater independence is achieved. The patient no longer relies heavily on the nurse for support and prepares to transition out of care. The therapeutic relationship ends professionally with emphasis on patient's autonomy and continued progress. Key concepts of this theory would be Peplau identified several important nursing roles within the therapeutic relationship that would include counselor, teacher, resource personnel, leader, and even a surrogate. These roles allow nurses to support patients holistically by addressing emotional, educational, and psychological needs. The theory emphasizes therapeutic communication, building trust, empathy, and structured interpersonal interaction as centered to patient healing, and its application to mental health care. This theory is highly applicable to mental health care setting because the patient experiencing conditions such as anxiety, depression disorders, anxiety disorders, schizophrenia, and trauma-related disorders often struggle with isolation, emotional distress, low self-esteem, and this difficulty trusting others. Establishing a structured therapeutic relationship helps feel safe, respected, heard, and understood. These elements are essential before meaningful treatment and recovery can even occur. Now, an example case study would be John Doe as our patient today. He is a 24-year-old male. He was admitted to a psychiatric unit after a recent suicide attempt. He has a history of major depressive disorder and he reports chronic feelings of hopelessness and worthlessness. John is socially withdrawn. He spends most of his day in his room and he avoids eye contact. And he speaks only when he is spoken to. He reports insomnia, loss of appetite, and lack of motivation for daily activities. A little bit of background information: John recently lost his job to prolonged absenteeism, and he feels he has disappointed his family. He describes constant negative thoughts, believing that he is a burden and that his life has no purpose. He expresses guilt over past decisions and has difficulty trusting others, including healthcare providers and his family. And his current situation: upon admission, John refuses group therapy and is hesitant to take his prescribed antidepressant medication, and he also avoids group activities. He demonstrates poor self-care, such as neglecting hygiene and skipping his meals. Despite this, he has shown brief moments of eye contact, and he occasionally responds to gentle, open-minded questions from the nursing staff. Now, if we were to apply the Peplau theories to this nursing care, we would start with the orientation phase. The nurse would introduce calmly, explain his or her role, and create a supportive environment. Therapeutic communication techniques such as active listening and open-ended questions can help reduce anxiety. The identification phase. John begins to share his feelings of guilt and hopelessness, and the nurse provides emotional support, validates emotions, and encourages expressions of his feelings, which helps strengthen trust. The exploitation phase. John engages in therapy, practices in a support group, and begins taking his prescribed medication. The nurse teaches coping strategies, psychoeducation about depression, and relaxation techniques while setting small, achievable goals. And finally, the resolution phase. John would show improved mood, increased social interactions, and independence in daily activities. The nurse would support his discharge plans and connect him to community resources, and concludes his therapeutic relationship positively. In conclusion, Hildegard's Peplau interpersonal relations theory remains highly relevant to modern psychiatric nursing practice. It helps us to emphasize that healing occurs through therapeutic relationships grounded in trust, communication, and empathy. By guiding nurses through structured phases of interactions, the theory supports compassionate, patient-centered mental health care and promotes meaningful recovery. Thank you for taking the time to listen to this video presentation.